Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Perioperative chemotherapy or preoperative chemoradiotherapy in esophageal cancer. Background. The best multimodal approach for resectable locally advanced esophageal adenocarcinoma is unclear. An important question is whether perioperative chemotherapy is preferable to preoperative chemoradiotherapy. See inclusions. Perioperative chemotherapy with FLOT led to improved survival among patients with resectable esophageal adenocarcinoma as compared with preoperative chemoradiotherapy. A randomized trial of drug route in out-of-hospital cardiac arrest. Background. In patients with out-of-hospital cardiac arrest, the effectiveness of drugs such as epinephrine is highly time-dependent. An intraosseous route of drug administration may enable more rapid drug administration than an intravenous route. However, its effect on clinical outcomes is uncertain. Conclusions. Among adults with out-of-hospital cardiac arrest requiring drug therapy, the use of an intraosseous first vascular access strategy did not result in higher 30-day survival than an intravenous first strategy. Intraosseous or intravenous vascular access for out-of-hospital cardiac arrest. Background. Out-of-hospital cardiac arrest is a leading cause of death worldwide. Establishing vascular access is critical for administering guideline-recommended drugs during cardiopulmonary resuscitation. Both the intraosseous route and the intravenous route are used routinely, but their comparative effectiveness remains unclear. Conclusions. There was no significant difference in sustained return of spontaneous circulation between initial intraosseous and intravenous vascular access in adults who had out-of-hospital cardiac arrest. Abelacimab versus Rivaroxaban in patients with atrial fibrillation. Background. Abelacimab is a fully human monoclonal antibody that binds to the inactive form of factor XI and blocks its activation. The safety of abelacimab as compared with a direct oral anticoagulant in patients with atrial fibrillation is unknown. Odd conclusions. Among patients with atrial fibrillation who were at moderate to high risk for stroke, treatment with abelacimab resulted in markedly lower levels of free factor XI and fewer bleeding events than treatment with Rivaroxaban. Next, we will be discussing articles from Journal of American Medical Association. Transanal versus Laparoscopic Total Mesorectal Excision and 3-year disease-free survival in rectal cancer. The TaLaR randomized clinical trial. Question: is Transanal total mesorectal excision, TME, non-inferior to laparoscopic TME in 3-year disease-free survival in patients with rectal cancer? Findings. The transanal TME group exhibited 3-year disease-free survival of 82.1%, compared with 79.4% in the laparoscopic TME group. The lower tail of a two-tailed 97.5% C for the group difference in 3-year disease-free survival was above the non-inferiority margin of -10 percentage points, meaning this study supports the use of transanal TME for patients preoperatively assessed with stage I to III rectal cancer, in places where expertise in surgical robotic techniques is not available. Next, we will be discussing articles from Annals of Internal Medicine Census Tract Rurality, Predominant Race and Ethnicity, and Distance to Lung Cancer Screening Facilities. Post-discharge contacts, PDCs, after hospitalization are common, but their effectiveness in reducing acute care use after discharge is unclear. In this systematic review of 13 studies, most PDC interventions, N equals 10, consisted of single telephone contacts and showed no differences in 30-day emergency department use or 30-day hospital readmissions. Findings suggest that health systems may wish to reconsider the utility of universal use of PDC. Assessing the risk for falls in older adults after initiating gabapentin versus duloxetine. Background: the evidence informing the harms of gabapentin use are at risk of bias from comparing users with non-users. Objective: to describe the risk for fall-related outcomes in older adults starting treatment with gabapentin versus duloxetine. Conclusion: compared with incident use of duloxetine, incident use of gabapentin was not associated with increased fall-related visits. Next we will be discussing articles from British Medical Journal. Dapagliflozin plus calorie restriction for remission of type 2 diabetes. Objective: to assess the effect of dapagliflozin plus calorie restriction on remission of type 2 diabetes. Conclusion: the regimen of dapagliflozin plus regular calorie restriction achieved a much higher rate of remission of diabetes compared with calorie restriction alone in overweight or obese patients with type 2 diabetes. Next we will be discussing articles from Lancet. Transarterial chemoembolization combined with lonvatinib plus pembrolizumab versus dual placebo for unresectable, non-metastatic hepatocellular carcinoma, LEAP-012, a multi-center, randomized, double-blind, phase 3 study. Background: transarterial chemoembolization, TACE, is standard care for unresectable, non-metastatic hepatocellular carcinoma. We aimed to evaluate the addition of lenvatinib and pembrolizumab to TACE versus dual placebo plus TACE in patients with unresectable, non-metastatic hepatocellular carcinoma. Interpretation: TACE plus lonvatinib plus pembrolizumab showed significant, clinically meaningful improvement in progression-free survival in patients with unresectable, non-metastatic hepatocellular carcinoma compared with TACE plus placebo. The numerical improvement in overall survival is encouraging, but longer follow-up is necessary. Next we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Efficacy and safety of roxadustat for anemia in patients receiving chemotherapy for non-myeloid malignancies. A randomized, open-label, active-controlled phase 3 study. Purpose: we evaluated the efficacy and safety of roxadustat, a first-in-class hypoxia-inducible factor prolyl hydroxylase inhibitor, for chemotherapy-induced anemia (CIA) in patients with non-myeloid malignancies receiving multi-cycle treatments of chemotherapy. Conclusion: roxadustat was non-inferior to R-HUPO-alpha in treating CIA in participants with non-myeloid malignancies receiving multi-cycle treatments of myelosuppressive chemotherapy. The oral formulation of roxadustat may potentially increase compliance. Here are the articles from Journal of Hepatology. Induction of steatosis in primary human hepatocytes recapitulates key pathophysiological aspects of metabolic dysfunction-associated steatotic liver disease. Increasing prevalence of MOSLD warrants new cellular models for drug development. In vitro model of steatotic primary human hepatocytes recapitulates MOSLD phenotypes. Forsocostat rescued steatosis and insulin resistance, providing proof of concept. Functional cure of hepatitis B in patients with cancer undergoing immune checkpoint inhibitor therapy. ICs can restore exhausted T-cell immunity, which may potentially cure chronic hepatitis B. Functional cure of hepatitis B was observed in patients with cancer or HCC undergoing EC treatment. ICs may accelerate HBs-Ag loss in patients with baseline HBs-Ag level less than 100 IU/ml. Next we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Glutamine supplementation as a novel metabolic therapeutic strategy for Lig-3-dependent chronic intestinal pseudoobstruction. Background and aims. We recently identified a recessive syndrome due to DNA ligase 3, LIG3, mutations in patients with chronic intestinal pseudoobstruction, leukoencephalopathy, and neurogenic bladder. LIG3 mutations affect mitochondrial DNA maintenance, leading to defective energy production. We aimed at identifying altered molecular pathways and developing possible targeted treatments to revert/ameliorate the cellular energy impairment. Conclusions. LIG3 deficiency leads to mitochondrial dysfunction. High levels L-glutamine supplementation were beneficial in LIG3 mutant cells and improved symptom severity without noticeable adverse effects. Our results provide a proof of concept to design ad hoc clinical trials with L-glutamine in LIG3 mutant patients. Here are the articles from Clinical Gastroenterology. Endoscopic submucosal dissection criteria for differentiated type early gastric cancer are applicable to mixed type differentiated predominant. Background. There is a lack of sufficient evidence on whether mixed type differentiated predominant early gastric cancer, MDEGC, can be treated endoscopically by referring to the criteria for differentiated type early gastric cancer, EGC. This study aims to evaluate the efficacy of endoscopic submucosal dissection, ESD, in MDEGC. Conclusions. Despite the greater malignancy and lower endoscopic curative resection rate of MDEGC, patients who met curative resection had a favorable long-term prognosis. Association between different types of physical activity and hepatic steatosis and liver fibrosis. A cross-sectional study based on NHANES. Background and aims. Many studies have shown a link between physical activity, PA, and non-alcoholic fatty liver disease, NAFLD. However, more research is needed to investigate the relationship between different types of PA and NAFLD. This study aimed to explore the potential link between different types of PA, hepatic steatosis, and liver fibrosis. Conclusions. Leisure time PA can prevent hepatic steatosis, and women and young people benefit more. Occupation-related PA is not associated with hepatic steatosis and cannot replace leisure time PA. In men, increasing leisure time PA is more effective in preventing liver fibrosis. Next, we will be discussing articles in the field of rheumatology. Frequency of spondyloarthritis symptoms among U.S. patients with inflammatory bowel disease, a cross-sectional multi-center study. Objective. Spondyloarthritis, SPA, is the most common extraintestinal manifestation of inflammatory bowel disease, IBD. The application of screening tools to detect SPA in patients with IBD may lead to earlier recognition of SPA and affect treatment decisions. Conclusion. A substantial proportion of patients with IBD have symptoms suggestive of SPA, and many of these may have undiagnosed SPA. The IBIS-Q questionnaire appears to identify more potential SPA cases than detail. Strategies are needed to prioritize rheumatology consultations for those patients with IBD who are most likely to benefit. Here are the articles from Arthritis and Rheumatology. Here are the articles from Journal of Clinical Rheumatology. Preliminary evaluation for the development of a scoring system to predict homozygous M694V genotype in familial Mediterranean fever patients. A single-center study. Objective. The aim of this study was to identify key parameters of a scoring system to be developed to predict the homozygous M694V genotype in patients clinically diagnosed with familial Mediterranean fever. Conclusions. This preliminary evaluation identified key parameters for a scoring system designed to predict the homozygous M694V genotype. A multi-center national study will further refine these parameters and develop the scoring system, which will aid clinicians in disease prognosis and therapeutic decision-making. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. A rare non-coding enhancer variant in SCN5A contributes to the high prevalence of Brugada syndrome in Thailand. Background. Brugada syndrome, BRS, is a cardiac arrhythmia disorder that causes sudden death in young adults. Rare genetic variants in the SCN5A gene encoding the NaV1.5 sodium channel and common non-coding variants at this locus are robustly associated with the condition. BRS is particularly prevalent in Southeast Asia, but the underlying ancestry-specific factors remain largely unknown. This is the first example of a functionally validated rare non-coding variant at the SCN5A locus and highlights how genome sequencing in understudied populations can identify novel disease mechanisms. The variant partly explains the increased prevalence of BRS in this region and enables the identification of at-risk variant carriers to reduce the burden of sudden cardiac death in Thailand. Here are the articles from Journals of the American College of Cardiology. Optimal strategy for complete revascularization in ST segment elevation myocardial infarction and multivessel disease, a network meta-analysis. Background. In patients with ST segment elevation myocardial infarction, STEMI, and multivessel coronary artery disease, most but not all randomized trials have reported that complete revascularization, CR, offers advantages over culprit vessel-only revascularization. In addition, the optimal timing and assessment methods for CR remain undetermined. Conclusions. Among patients with STEMI and multivessel disease, outcomes were better with immediate or staged CR compared with culprit vessel-only treatment, whether with angiographic or functional guidance. From JAMA Cardiology. Cost-effectiveness of a polypill for cardiovascular disease prevention in an underserved population. Key points. Question: would a cardiovascular polypill, single pill containing a statin and 3/2 standard dose antihypertensives, be cost-effective versus usual care in a majority Black race and low-income population? Findings. In this economic evaluation, a computer simulation model was used to assess the cost-effectiveness of a cardiovascular polypill in a cohort of 100,000 individuals, representative of the Southern Community Cohort Study polypill trial population, who were probabilistically sampled from 3,720 individuals in the National Health and Nutrition Examination Survey. Polypill treatment was projected to cost $8,560 per quality-adjusted life year. QALY gained compared with usual care and was high value, less than $50,000 per QALY gained, in 99% of simulations, meaning results suggest that polypill treatment would be high value if priced at $463 or less per year, and could reduce income-related health disparities. Next we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Personalized Medicine in Acromegaly, the ACROFAST Study. Context. Medical treatment of acromegaly is currently performed through a trial-and-error approach using first-generation somatostatin receptor ligands, FGSRLs, as first-line drugs, with an effectiveness of about 50%, and subsequent drugs are indicated through clinical judgment. Some biomarkers can predict FGSRLs response. Objective. Here we report the results of the ACROFAST study, a clinical trial in which a protocol based on predictive biomarkers of FGSRLs was evaluated. Personalized medicine is feasible using a relatively simple protocol, and it allows a higher number of patients to achieve control in a shorter period of time. Here are the articles from Diabetes Care. Diabetes overtreatment and hypoglycemia in older patients with type 2 diabetes on insulin therapy. Insights from the HypoEdge cohort study. Objective. To assess the accuracy of diabetes overtreatment proxy definitions in predicting hypoglycemia in older adults with type 2 diabetes, T2D, conclusions. A revised definition of diabetes overtreatment is needed to better manage older insulin-treated patients and protect them from hypoglycemia. Next we will be discussing articles in the field of pulmonary and critical care. Here are the articles from CHEST. Neutrophil-mediated inflammatory plasminogen degradation, rather than high plasminogen activator inhibitor 1, may underlie failures and inefficiencies of intrapleural fibrinolysis. Background. Complex pleural space infections often require treatment with multiple doses of intrapleural tissue plasminogen activator, TPA, and deoxyribonuclease, with treatment failure frequently necessitating surgery. Pleural infections are rich in neutrophils, and neutrophil elastis degrades plasminogen, the target substrate of TPA, that is required to generate fibrinolysis. We hypothesized that pleural fluid from patients with pleural space infection would show high elastis activity, evidence of inflammatory plasminogen degradation, and low fibrinolytic potential in response to TPA, that could be rescued with plasminogen supplementation. Research question. Does neutrophil elastis degradation of plasminogen contribute to intrapleural fibrinolytic failure? Interpretation. Our findings suggest that inflammatory plasminogen deficiency, not high Pi1 activity, is a significant contributor to intrapleural fibrinolytic failure. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Lung transcriptomics link emphysema to barrier dysfunction and macrophage subpopulations. Rationale. Although many studies have examined gene expression in lung tissue, the gene regulatory processes underlying emphysema are still not well understood. Finding efficient non-imaging screening methods and disease-modifying therapies has been challenging, but knowledge of the transcriptomic features of emphysema may help in this effort. Objectives. Our goals were to identify emphysema-associated biological pathways through transcriptomic analysis of bulk lung tissue, to determine the lung cell types in which these emphysema-associated pathways are altered, and to detect unique and overlapping transcriptomic signatures in blood and lung samples. Conclusions. This study identified emphysema-related changes in gene expression and alternative splicing, cell type-specific dysregulated pathways, and instances of shared pathway dysregulation between blood and lung. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Fracture in association with anticoagulant therapy in patients with CKD and atrial fibrillation. In patients with CKD and atrial fibrillation, we observed no difference in the rates of fracture between initiators of direct oral anticoagulant and warfarin. However, direct oral anticoagulant use relative to warfarin was associated with a lower risk of all-cause mortality. Albuminuria and rapid kidney function decline as selection criteria for kidney clinical trials in type 1 diabetes mellitus. Severely increased urinary albumin excretion rate is an effective criterion to select persons with type 1 diabetes at high risk of GFR decline for enrollment in clinical trials. A history of rapid GFR decline is less effective, but can be used to extend clinical trials to person with normoalbuminuric diabetic kidney disease. These findings have immediate implications for the design of clinical trials of novel renoprotective interventions in type 1 diabetes. Here are the articles from Kidney International Reports. Muscle mass, muscle strength, and health-related quality of life in kidney transplant recipients. Introduction. Muscles are crucial for daily activities, and kidney transplant recipients, KTRs, often have reduced muscle mass and strength. We aimed to investigate the potential relationship of muscle mass and strength with physical health-related quality of life, HERCL, in KTR's conclusion. Low muscle mass and strength are potentially modifiable risk factors for impaired physical HERCL in KTRs. The nonlinear associations suggest that KTRs with low muscle mass or strength may particularly benefit from rehabilitation interventions to improve HERCL.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.